All right. Welcome everyone to our weekly sessions with Dr. Kamal. Today's topic is pediatric infectious diseases. Thank you so much, Dr. Kamal, for joining. Go ahead.
Okay, so welcome to everyone. Uh, I don't know how to.
I
Okay,
think
so this is the uh, second slide. So this is a patient, different patients. They are having fever and starts off with a low-grade fever, starting with like eye congestion, runny nose, and then a rash appears. When the rash appears, then the fever goes very high. Okay. Before the rash appeared, there were some whitish lesions across just opposite the molar teeth. They're like sand grain type. The rash is generalized maculopapular, starts behind the ear, goes down, and it disappears in the same pattern. So, what is the diagnosis?
measles,
Very good. So is it a RNA virus or DNA?
RNA,
Very good. What is the incubation period?
14 to 21 days. 10 to
Well,
14.
that is not correct.
Is it 10 to 14?
Yes, so about 7 to 14 days. So why are we worried about measles? Why is it such a regarded such a bad disease?
Uh, there are quite a few complications of measles.
Like what?
Um, the one that appears the most late is subacute sclerosing panencephalitis. Other than that,
That
we
is not very common,
Yeah. Other than that,
right?
we have pneumonia, diarrhea, and
Yes.
yeah,
What else?
um, measles.
So
Uh,
acute encephalitis. Acute encephalitis is very common.
okay.
Okay. So diarrhea, pneumonia, acute encephalitis, virtually any itis can happen. They can have stomatitis leading to painful ulcers, noma, Noma, dehydration, right? Then they can have failure to thrive, malnutrition. The important thing is that the immunity goes down, so they can have um, superadded bacterial infections, tuberculosis, things like that. The immunity can be depressed for 18 months. Okay. So they can die and they from different complications like bronchopneumonia. They have hacked giant cell pneumonia. So when is the vaccine given?
There's two that are given in Pakistan, I believe 9 months and 14 months. MR.
Very good. Very good. In the US, we give those at 1 year and then 4 to 6 years. But if a child is traveling to Pakistan, we can give it as early as 6 months. That is counted as a zero dose. So zero dose, and then when they come back to Pakistan to USA, then we give them dose number one and dose number two at 4 to 6 years. Okay. So this is a live attenuated vaccine. And sometimes when we give the vaccine, we tell the parents that they can have a slight reaction 10 to 12 days from the time the vaccine was given. Okay.
Mhm.
Now, this is a non-vaccinated young girl who is um, who has a fever for 3 days. And then she has got some dots between the hard and the soft palate. She has a rash all over her body, and the rash goes away in about 3 days. And she has some joint pains. So, what is the diagnosis?
Rubella.
Very good. What is the other name?
German measles.
Very good. What is the incubation period?
Mm, 14 days.
Yeah, 2 to 3 weeks. Okay. So there are to remember it is crumbs, chickenpox, rubella, and mumps. They are like 2 to 3 weeks. Okay. So there are some conditions which very small incubation, short incubation periods, then long incubation periods, then very long. Very long would be example would be mononucleosis. It's like sometimes it can be 1 to 2 months. Okay, but this is an intermediate one, 2 to 3 weeks is rubella. So when is the vaccine given?
For rubella, it's in Pakistan, it's given with measles, so 9 months and 14 months.
Yes, in America it's given at 1 year and then 4 to 6 years. And what is the most dreaded complication of rubella?
Dreaded complication.
Pardon?
In the child?
Well, in any age.
I mean, it's
Hearing
basically
loss?
What?
Does it cause hearing loss?
Yeah, if it is congenital rubella, then they can have hearing loss, and the uh, congenital rubella can also manifest have a like a patent ductus arteriosus, right? And
cataracts.
rash. So if a pregnant mother has not had and she contracts the rubella, then she can have this lot of issues with the in the baby, right? Okay, so the other thing is the rubella worse in the baby in the early part of pregnancy or later part of pregnancy?
Early part.
Good. So rubella is important. Okay.
Okay.
This is that. Okay, this is a very itchy rash, multiple lesions. Diagnosis?
Chicken pox,
Very good. And when is the vaccine given?
chicken pox.
Same. 1 year and then 4 to 6 years. It's
Mhm.
again a live vaccine. What's the incubation period?
I believe 2 weeks.
2 to 3 weeks.
Okay.
So it's like crumbs, chicken pox, rubella, and mumps.
Right. Okay.
What are the complications?
Chicken pox can cause encephalitis, pneumonia. Um, oh, and also there's um like trigeminal neuralgia, postherpetic neuralgia, things like that. Shingles.
One of the complication is superadded bacterial infection because when the vesicles they break down and the scabs and then if they we don't take care of the skin then it can become secondarily infected. Okay, they can have lesions in the mouth and things like that. So chickenpox can cause hepatitis and pneumonia as well. And so the younger the age, the better the prognosis. If you get the chickenpox later on, then it's a little bit more serious. Okay. So chickenpox. Okay, this is atypical chickenpox. So we used to do one shot in of chickenpox like in around 2002, 2003, 2004 when I started. So we still used to see chickenpox in like some lesions. But then we started doing two, and then the chickenpox practically disappeared. So in America, the vaccine hesitant families they sometimes go to pox parties. So where somebody has chicken pox, they rub that the fluid to in order to get chicken pox because they think that natural immunity is better. And but the problem is that they can have serious complications. So vaccine is always better to give because it's live attenuated vaccine. Okay, so this is just concentrate on the picture number A for apple. Okay, so describe the rash.
Does anyone want to go ahead, or should I?
Anyone can go ahead.
Okay. So the rash basically is one enormous patch on the skin. There's maroon, black, red lesions present, and it resembles cellulitis or necrotizing fasciitis. Um,
Well, necrotizing fasciitis would be very deep, deep. Okay.
okay, this is
And
superficial.
cellulitis is likely, but cellulitis is generally red. This is very ugly. This is bleeding in the skin like red and black. Whenever there is black, it means there is death.
Oh,
Okay.
mhm,
So this is necrosis with bleeding in the skin. So this is a localized DIC, disseminated intravascular coagulation. So localized DIC is called purpura fulminans. Okay, and that can be a complication of measles. It can, in which case it is also called black measles, hemorrhagic measles. And the second condition in which you can find it is meningococcemia. So it's a very bad sign. Purpura fulminans is a very bad sign. Okay.
mhm,
This is a young girl who was not vaccinated and has very itchy lesions in uh, uh, multiple phases. This is chicken pox. Okay. This is a chicken pox in one area only on one side. Was it, what is it called?
Shingles.
Shingles. Very good. So this is can happen in children as well. Okay. Very painful.
Mhm,
Okay, this is a very interesting case in which there is high fever and blanching rash. The conjunctivitis is there, but there's no pus in there. The throat is very red. There are exudates on the tonsils, and the rash is blanching on the skin. Diagnosis?
It's not scarlet fever.
Well, let me give you a hint that the strep test is negative. Also, in scarlet fever, you will get a sandpapery rash, you
Mhm.
will get pastia lines, you will get strawberry tongue, but you won't get this non-purulent conjunctivitis. Okay, you should write down these causes. So, the blanching rash is seen in vasculitis, in adenoviral skin rash, and in Kawasaki disease. Okay. The exudative tonsillitis is seen in two viral conditions and two bacterial. So viral conditions are mononucleosis and adenovirus. Bacterial conditions are streptococcus and diphtheria. And then non-purulent conjunctivitis is seen in uh, Kawasaki disease as well as in adenovirus. Okay. So this is a patient with adenoviral infection. Okay, so sometimes they can have just the eye and the lymph nodes are swollen on the in the cervix and just in front of the ear, and that case that is called oculoglandular syndrome or Perinaud's syndrome. Okay, so adenovirus, this is an adenoviral infection. So how many serotypes do you have for adenovirus?
I don't know. I'm not sure.
About 70. So they are grouped into A, B, C, D, E, F. Okay. So this is adenovirus. Adenovirus is it a DNA virus or RNA virus?
The DNA virus.
Pardon?
Pretty sure it's a DNA virus.
It is DNA. So the DNA viruses are easy to remember. There is AHP, adenovirus, all the herpes viruses, and the parvovirus B19. These are all three main categories are DNA. All the rest are RNA viruses. So this is one of the DNA viruses, adenovirus. Okay, this is adenoviral infection. And okay, this is the next case. Then very painful ulcers surrounded by red halos. So skin rash, this is an exanthem plus enanthem. Diagnosis? Yes?
It's not measles. Um, it's not hand, foot, and mouth.
It is hand, foot, and mouth. Very good. So these are painful ulcers in the mouth, and then there is rash over the hands and the feet and the buttocks. Is hand, foot, and mouth. Very good. This is again hand, foot, and mouth. So there can be small blisters, small macules, papules. Okay. This is again hand, foot, and mouth. Okay. Okay, which this is a very important rash. There is a slap cheek appearance and then lacy rash over the body. Once the rash appears, they are no longer contagious. Diagnosis?
Roseola.
No, wrong.
It's not roseola. Parvovirus?
Parvovirus. So it's also called fifth disease. So when you slap across the face, you slap with a hand. So five. So fifth disease. So what is the name of the virus?
Parvovirus B19?
Yes, very good. And so, what is the main thing that you have to tell if you see a patient like this?
Main thing. Mm,
The main thing you have to tell is that was the child around a pregnant mother before the rash appeared? Because that mother can have parvovirus B19 exposure, causing severe anemia in the baby, which is called erythroblastosis fetalis, hydrops fetalis. Okay.
okay.
So if that is the case, you have to tell them to go to the gynecologist and get themselves checked. Okay.
Hmm.
So this is also called erythema infectiosum, fifth disease, parvovirus B19, slap cheek rash. Okay, very common. Okay, which rash is this? Very high fever, followed by a generalized rash. Now this is different from measles. In the measles, when the rash appears, the low grade fever goes very high to become very high grade. But in this condition, the child is very happy and healthy, and they have a very high fever of unknown origin. The fever goes away, the rash appears.
Is this roseola?
Correct. What is the name of the virus?
Um, HHV 8 or 6? I think 6.
Yes. Human herpes 6 and 7. Okay. Roseola. Okay, this is exudative tonsillitis, rash, and eyelid edema. Diagnosis?
Exudative tonsillitis and eyelid edema. Mm.
So he tried to shave himself, and then this rash appeared over the face.
Strep pyogenes?
Strep is negative.
I don't know. Mm.
So mononucleosis.
This is mono.
Spleen is enlarged. Spleen is enlarged, so they can have exudative tonsillitis, okay, and eyelid edema.
But
So, hmm?
how is the scenario related to the disease? Because infectious mono is basically like saliva transmission or something, right? That's the mode of
Correct.
transmission.
Yeah, but it's thought to be a kissing disease only in adolescents, but young children can have it too.
Okay.
Okay. So very important to know that they can get it from being kissed, or they drink some contaminated, like infected water or something, they can get that.
Okay.
Okay. What is the incubation period?
You said it could be extended like a month.
30 to 60 days. 30 to 60 days. And how many of serotypes does it have?
I don't know.
Just two.
Okay.
Okay. So you have to remember these facts and figures. The measles has only one serotype. Mononucleosis has two. Adenovirus has got more than 70. Enteroviruses have more than 100. Okay. So
Mm.
you have to remember those things, okay? So what are the complications of mononucleosis?
Um, Splenic rupture, encephalitis,
Mhm.
secondary bacterial infections, pneumonia, I think. That's all I remember.
Well, chronic fatigue syndrome, headache, neuralgia, hepatitis, okay, and then hematological complications. Virtually any system can be involved. Sometimes the things appear small, sometimes the things appear large. So that is called micropsia and macropsia. And then sometimes that is also known as Alice in Wonderland phenomenon. They are like confused, they have chronic fatigue, spleen can rupture. First 3 weeks are very important, so we have to tell them. And the cells are called Downy cells or Turk cells. These are reactive lymphocytes, though they are not monocytes, but they are reactive lymphocytes. Okay, so B lymphocytes and things like that. So you have to know. Okay, gingival swelling and painful ulcers.
Oh, herpes.
Very good. The human herpes, one is usually in the mouth and two is in the vaginal area. And this is herpetic Whitlow, very painful condition. Herpetic Whitlow again, okay. This is herpes in the periorbital skin, ocular herpes. This is periocular herpes, right? Then we have ulcers. There are two types of ulcers from herpes, dendritic ulcers and disciform ulcers, and they are cause of painful eye, and so they have to be treated. Sometimes, if herpes spreads in a child with eczema, it spreads like wildfire, and they look like chickenpox, but they are not like chickenpox because they are monomorphic. So, chickenpox lesions are polymorphic. All stages, these are in same stage, but they look like chickenpox, so they are called Kaposi's varicella eruption. Okay, so this is actually herpes simplex in a child with eczema. So recurrent cold sores can be due to herpes labialis, and the herpes can have dermatomal distribution, but if you see it in localized area, that is more herpes zoster. Okay, and okay, what is this condition? It happens in many common viruses, and the sudden appearance of papules in a child without eczema. More over the elbows and the knees. Can be over the face too.
Mhm. Not it, but no, it's not psoriasis. Um,
No, no, no. It can happen in in many viral infections. So the name of this phenomenon is Guillain-Barré syndrome.
okay.
So this comes up in the boards, and they will ask you about this. So sudden appearance of flat topped papule in the course of a viral infection is called Guillain-Barré syndrome. Okay. Now this is very important. Strawberry tongue, sandpapery rash, sore throat. Diagnosis:
Scarlet fever.
scarlet fever. And the strep. It's a strep with a super added antigen from diphtheria. So that causes the toxicity. And so this, what is this? Very sick patient with um, you know, de- ruptured bulla with denuded skin.
Is it like epidermolysis bullosa or
It
uh,
looks like that. Looks like that. One of the differential, but this patient is very sick, very high fever.
um, scalded skin syndrome?
Very good. Staphylococcal scarlet skin syndrome. So very, very important not to miss that. Okay. And this is tender sandpaper-like skin, cracked, weeping, periorbital skin. So this is staphylococcal scarlet fever. Very rare, but it can happen also. Okay. So this is a very important condition that you should never, ever, ever miss. Okay. In fact, I have diagnosed some cases when the ER physicians they missed it. So this is a blanching rash, sunburn. It's called sunburn rash with blanching. Blood pressure is very low, like 50 systolic. Headache, vomiting, very sick. The cause is a localized area only. It could be a small ulcer with infection. It could be the source could be in the nose. It could be in the tampons.
It's staphylococcal shock syndrome, right?
Toxic shock.
Yes.
Toxic shock. Yes, very important. Toxic shock has to be recognized. Okay, and they look very very sick. Okay. Okay, this is very important. Bulging fontanelle and nuchal rigidity, very high fever.
Meningitis.
Very good. What are the causative organisms?
There are three that are commonly caused in neonates, so GBS,
Yeah.
E. coli, and Listeria monocytogenes.
Well, the other ones in the older children are Haemophilus influenzae and meningococcemia.
Yeah.
Okay. So very important to this is meningococcal meningitis and this is meningococcemia and then what is this condition called in the red and the black? What is it called?
Um, but erythema fulminans. Wait one second, I wrote it down.
No, purpura fulminans.
Purple.
Purpura fulminans.
Okay.
Purpura fulminans. Okay. So this is meningococcemia, and then the adrenal hemorrhage can happen, which is called Waterhouse-Friderichsen syndrome. So this patient had renal shutdown. We did dialysis, but he did not survive. Okay. So this is another rash which you don't see in very much in Pakistan, but you can see it in Connecticut and other northeast states. There's a bite and then a rash starts and the circle appears and it keeps on spreading. There are three phases. Any diagnosis?
Erythema migrans.
Yes. Over the uh, what is
Lyme,
the
Lyme disease is usually
very good, very good, very good, very good. So this is what are the three stages end up?
there's the first stage, I believe, is where the bite occurred, the rash enlarges. Uh,
Second one,
the second, I believe, is migratory. I don't remember.
okay, then the third,
The the third stage of Lyme disease, is that what you're asking?
yes.
So the third stage has the carditis and the heart block and the migratory arthritis, things like that.
What is the treatment?
The treatment is doxycycline.
Very good. And in young children,
Ceftriaxone?
no,
Mm,
we could do amoxicillin, okay? So
so
this is Lyme disease. You need to brush up on this a little bit more. Okay, what is this petechial rash that spreads centripetally?
centripetally.
Very sick child.
What does centripetally mean?
Like going from the periphery to the trunk versus centrifugal is going from the trunk to involve the hands and the feet. So this rash starts in the hands and the feet.
Is
Petechial rash.
rickettsia?
Very good. So Rocky Mountain spotted fever. Okay. And what is this condition? Unilateral tender parotid swelling.
Could be mumps.
Very good. And what's the incubation period?
2 to 3 weeks.
Very good. When is the vaccine given?
Uh, for Pakistan, it's 9 months and 14, but for the US, it's 1 year and 4 to 6.
4 to 6 years. Good. And this is different. This looked like mumps, but it turned out to be suppurative parotitis. Okay, so parotitis can be caused by different bugs like Epstein-Barr virus, staphylococcal, then mumps, is one of the causes. One of the causes we see in this kind of season is influenza can cause parotitis as well. Sometimes I've seen parotitis after COVID virus also. Okay, pustules with a thin rim, thin red rim.
Mhm.
So
Is
this is folliculitis.
Does it?
Folliculitis is can be multi form or uniform. So if it is uniform folliculitis, it's fungal. But if it is multi like many form polymorphous, then it is usually staph. Okay. Okay. This is very important. Honey color crust.
impetigo?
Very good. And the treatment is for localized lesions, we use mupirocin ointment, but for generalized lesions, we use cephalexin. Okay. And this is also impetigo, the honey crusted lesions, and the parents are very scared. They think it is a ringworm, but it's not a ringworm. Okay. This is again honey colored crust below the lip, and this is impetigo. And so this is a very important one that comes up in exams, USMLE. I've never seen it, maybe once or twice, but this is important. Pustule that crusts and then forms an ulcer.
Oh, is this Francisella?
Ecthyma.
Pardon?
Uh,
Ecthyma.
Yes, very good. Ecthyma. So ecthyma is can be caused by pneumococcal, but if it is multiple, it's caused by pseudomonas. Okay, so pseudomonas will lead to ecthyma gangrenosum. Okay, so fortunately, I have seen only very few cases, one or two maybe in my lifetime. So this is a superficial abscess along the fingernail. What is it called?
mm,
Paronychia. Okay.
uh,
So the treatment is we incise and we drain out the pus, and sometimes we have to do nail treatment as well. Okay. What is this condition called? Pellifollicular dermal abscess?
uh, Caruncle or carbuncle?
No, it is fruncle.
Caruncle.
Okay. So you need to know that there's folliculitis, then there is fruncle, and then finally there's a carbuncle. If the fruncle is not taken care of, it can spread all over and cause carbuncle. Okay, folliculitis, fruncle, carbuncle, three stages. Okay, this is infection in the axilla or in the groin. What is it called?
Is
Hydinitis.
yeah.
Yes, very good. Hidradenitis suppurativa, very difficult to treat. Okay. And sometimes the children can have breast abscess from what happens is they had like milk, which is milk, and then the parent tried to squeeze the breast tissue, and then the staph got in, and that caused the breast abscess. Okay. So we always tell do not, if you see milk coming out of the nipple, do not try to express it. Leave it like that. Okay. Scalp abscess can be there. Then lymphangitis is inflammation of the lymph vessels. Puncture wound infection is caused by Pseudomonas. Okay, but sometimes the board will give you questions like, which is not a dirty wound but just a regular infection. So that in that case, it's likely to be staph. But if they give a dirty nail picture, then it is Pseudomonas. So this is a very important rash, which many times people don't diagnose, and this is associated with very high fever, and the rash keeps on spreading, and it's very painful, and fever, vomiting. Diagnosis?
cellulitis?
No, cellulitis is more deep. This is a superficial spreading infection. So it's called.
Erysipelas.
Yes, erysipelas, very good. So it is due to strep. In this case, we use a big gun like ceftriaxone. And the difference from cellulitis is that cellulitis is more deep. And if it is in the facial area, the erysipelas, because it's more superficial, it will go into the ear, but the cellulitis will not go into the ear. Okay. So this is called Million's ear sign, which means that the erysipelas has gone into the ear because it's so superficial. Okay, but in cellulitis it will not go. Okay, what are these indurations? The child is very happy, healthy, but there it's when you touch the cheeks, he cries. He was given some popsicle by the mother.
It's not impetigo. I'm not sure.
No, no, no need to treat, no need to, just reassurance. So this is called popsicle paniculitis. So this is damage to the fat in the cheeks by very cold. Like very young children, they cannot tell you that they are like they get numb and then they get damage to the fat. We can move the popsicle out, but if the popsicle stays for a long time, that can cause fat damage. But generally, it heals very well. Okay. So this also comes up in steps. I I have known through some students that it comes up in the steps a lot. Okay, this is very serious. Fever, irritability, tender warm swelling. The parotids are not involved, but the cheek is involved. So this is called buccal cellulitis due to Haemophilus influenza. Usually it is non-typable. Okay. And wound related infections you need to know, ear piercing, dog bite, mosquito bite. So the what is the infection that we dread after dog bite?
Rabies.
Yeah, but what bacterial infection?
Oh, um,
So
Pasteur.
Pasturella multocida, and the treatment is augmentin or um, unison. Okay, so these are very important. Impetigo can lead to cellulitis, and the doctor thought that it was contact dermatitis, but turned that it was cell infection. Okay, this is very important rash. So there is a deep necrosis beyond the erythema, very deep. It's called flesh eating.
Flesh eating. Necrotizing fasciitis?
Yes, and the bug is what?
Mm,
Streptococcus pneumoniae. Streptococcus, sorry, streptococcus. So streptococcus can cause erysipelas, superficial spreading infection. It can also cause necrotizing fasciitis. Okay.
So if it causes erysipelas, can the patient also be not too ill looking? Can they also
No,
like
no, no. Erysipelas are very ill looking. Necrotizing fasciitis is very ill looking.
okay.
Okay. If the patient is not ill looking and there is a rash, like yesterday I diagnosed a case who looked like erysipelas, so there was a rash over the knees and the elbows,
Mhm.
and they were very localized. So that was a contact dermatitis to being seated in a new high chair. So the high chair pads came into contact with the skin and
Mhm.
they caused the reaction. Okay.
Mhm.
So lymph nodes can be large. You have to know anterior lymph nodes, posterior lymph nodes. In Kawasaki disease, you got to remember that the anterior lymph nodes are involved. Okay, and the tonsillar and lymph nodes can be large in streptococcal infection, and sometimes in viral infections too. Post-auricular lymphadenitis can be seen in cases when there is a ringworm of the scalp, which is called tinea capitis, right? And then these are inguinal and femoral lymphadenitis. And if they don't look infected, they can be due to atypical mycobacteria. So we had a case last week in which the groin lymph node was extremely red, tender, and painful, and there was a scratch over the knee. So that was the cat scratch disease. Okay, so cat scratch disease is caused by what bug? Zainab?
Um, mm,
Bartonella Hensley.
or another Hensley. Yeah.
Okay, and the treatment is azithromycin.
Yeah.
Okay, and the cat bite can cause which bug?
Pasteurella.
Pasteurella. Okay, so cat bite and cat scratch are different. Okay,
Mm.
now this is a gradual enlargement, mild tenderness. So this is again atypical mycobacteria, and the treatment is always excision. You excise, and that takes care of that. Okay, acute painful enlargement of lymph node on one side is acute suppurative lymphadenitis. Sometimes we have to give them cephalexin and they improve. And this is again acute suppurative lymphadenitis. And this is scratched by a new kitten. Then you see lymph node in the axillary region. It's called cat scratch disease. And the treatment is
Uh,
azithromycin. In rare cases, we can do doxycycline. Okay, and sometimes we have to use surgery to get rid of them. Okay, this is a moth-eaten appearance of the humerus and extremely painful legs. Okay, so this is osteomyelitis, multifocal osteomyelitis. So in young infants, the osteomyelitis will spread all over the body because they are connected, they are not separated by cartilage. In older children, there's cartilage, so they will remain localized. Okay, and this is fever, pain, refusal to walk. This is acute osteomyelitis in 5 year olds, so this will stay localized. Okay, and these are some radiological signs. Then when you see bones are being sequestrum, involucrum, the treatment is usually we treat them for staphylococcal. Okay, and technetium 99 can also show increased uptake. Subacute osteomyelitis can be there, which has been lasting very long, and you see how the bones are eroded. Sometimes there can be chronic osteomyelitis, and I have seen cases in Pakistan in which the patient had TB and they were just sitting without any fever and they had osteomyelitis. So that is chronic osteomyelitis. Sometimes vertebrae can be involved in osteomyelitis that can cause very painful deformities like gibbous. Okay, and so in if the joint is involved, that will cause knee pain and swelling, and that is called septic arthritis. So anyone can tell me what how will you clinically differentiate septic arthritis from osteomyelitis?
Synovial tap.
Pardon?
Synovial tap.
Yeah, very good. So synovial that, and then the with the arthritis they won't be able to move the joint, but in osteomyelitis they may be able to move the joint. The pain is in the limb. Okay, and this will you will see some extra fluid in the on one side if you are worried about uh, arthritis, septic arthritis of the hip. And this is a boy with very large lymph nodes on the, as you can see on the back. What could be the cause?
Be Could be rubella or
No, 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 no. These are huge. Rubella, you will see occipital lymph nodes, small ones. These are so a significant lymphadenopathy is defined as a lymph node size of more than 2 centimeters. So this is more than 2 centimeters. So fever, weight loss, sweating for more than 6 months, and
TB.
slowly enlarging. Hmm?
Is it TB?
Tuberculosis,
Yeah.
TB. And this young patient also has TB. And this one has got the TB has got that the capsules broke down, and this caused a cold abscess, which means that it's not hot. So if this is again tuberculous lymphadenitis with abscess formation, cold abscess, and this is a positive TB test, and the induration is more than 10 millimeters. And then this is Gons focus, which is in the lungs. And we do see sometimes TB in the US. It takes a little bit of index of suspicion to suspect, so from migrants. And we diagnosed cases of pulmonary TB in children from Vietnam. and they spread it to the school. So we had to check everybody, get X-rays and things like that. So Gon's focus is in the subpleural space between the upper and the middle lobes, and then Gon complex is lymphangitis with the infiltrate. So this is again miliary tuberculosis, which is seed-like shadows in all over the lung and immune compromise in young children. And this is tuberculous spondylitis, so damage to the vertebral column. This is a fusion that I drained myself. And if you can see, it's a lamellar effusion versus our purulent effusion. This is a TB effusion. If you get the fluid out, it is straw colored and it's very high in protein, and it forms a cobweb like a spider web on the top because of the very high protein content. Once we find it, then we don't drain it, because if you drain it too much, then they lose a lot of protein. Okay. And this is a boy I was telling you that I diagnosed with tuberculous osteomyelitis, chronic draining sinus on the right thigh. Okay, this is a patient I diagnosed with tuberculous gibbus. So there is acute deformity, and they sometimes these children cannot cannot even walk because the nerve roots are damaged. This is a slide from New England Journal. This is a patient who was sexually active with multiple females, and he has got rash over the hands. Diagnosis?
Secondary syphilis.
Very good, very good. So this is toxoplasmosis, which can lead to calcification in the brain. So toxoplasmosis is one of the causes of torch infection, which are toxoplasmosis, rubella, cytomegalovirus, syphilis, and So this is a blueberry muffin rash, which is extramedullary hematopoiesis seen in rubella and CMV. And this is also from New England Journal, very nice blueberry muffin rash, so which can be seen in torch infections and acute myeloblastic leukemia. This is skin is forming red cells because the bone marrow is knocked out. This is neonatal herpes simplex, okay, very serious condition. This is congenital syphilis with bony signs and skin rashes. Okay. Neonatal tetanus is very important because we had a tetanus ward in Mayo Hospital where more than half of the children they used to die, and they used to come from the Peshawar area, and the cord was cut with unsterile scissors. So with even with minor stimulation, they go into severe spasm. Okay, AIDS is important in sub-Saharan Africa. I'm sorry, they can have thrush, diaper rash. They can have pneumocystis jirovecii pneumonia. They can have multiple lesions of molluscum contagiosum. They can have cognitive difficulties, frontal lobe and basal lobe calcification, volume loss. They can have CLIP, which is chronic lymphoid interstitial pneumonia. And in the boards, they love to ask about differences between CLIP and the pneumocystis jirovecii pneumonia. Clubbing can be seen in CLIP. And then this is Kaposi's sarcoma seen in AIDS. AIDS can also cause cardiomyopathy. And this is a patient with severe dehydration in a developing country. What are the signs you see for severe dehydration?
Sunken eyes,
Yes, what else?
Severe
lethargic,
dehydration,
unable to
yeah.
drink,
Inability.
Altered mental level. Very good. What is the cause for this?
It could be long-standing diarrhea. Um,
Okay. What is the cause of the diarrhea? The name of the bug.
um,
Rotavirus.
okay. Underlying.
And after the rotavirus has gone down, what is the second virus in North America?
Norovirus?
Very good. So that is the second most common. Okay. And this is a skin lesion. First, the big lesion appeared, which is called the Herald patch. Then the multiple lesions appeared in a Christmas tree pattern. What is the diagnosis?
Pityriasis rosacea.
Rosea, rosea. And what is the treatment? Reassurance, reassurance. So tell them that this lesions can last for a year or more. Okay. So this is a nummular eczema. It looks like a ringworm, but it's coin-shaped eczema, and the treatment is emollients and steroids. Uh, I think that's the end of the slides. Okay, questions?
Just wanted to ask pityriasis rosea.
Yes?
What are common causes of it?
No, nobody knows.
Okay.
Unknown cause. Unknown cause.
There's one infection that basically occurs in children when they don't shower and they sweat a lot, they don't change their clothes.
Yes?
What infection is that?
I don't know. You got to tell me a little bit more because there are many infections that can happen like that.
I believe there is small rashes just like this on the body. Um, not sure anything else about it. It's okay. I'll look it up.
When they don't shower and
Basically, small rashes appear on the body that are little itchy, they're red.
well, one cause one would be the eczema. Second one would be sometimes it can be molluscum lesions which are there for a long time. Thirdly, it could be a skin infection. Fourthly, it could be lice because I just recently diagnosed a case with lice. They didn't have access to water and they were not bathing and they were sleeping together and they got lice everywhere. And then they had so usually the lice is on the hair, but sometimes it can infest the inguinal area and shaving area and then the eyelids, and sometimes they can have scabies. So it's a lot of conditions that are spread by unhygienic, not just one. So I can think of multiple. So unless you narrow down the scenario, it's very difficult to tell which one it would be. Okay.
Okay.
Yeah. So most of these slides are taken from Zitali. Have you heard of Zitali?
Mm,
Zitali is Atlas.
okay.
Zitali. Zitelli. Zitelli. Okay. So that's a very good atlas. Whoever wants to go into pediatrics should have a copy. So you can have it online, or it's a very good atlas. Most of the cases, board questions, they come from that Zitelli, like similar pictures. And this presentation of mine from today is also from most of the pictures are from Zitelli. So who has heard of Zitelli? Nobody?
No.
Anyway, so just read. Zitali is, I met Professor Zitali, a very nice professor of pediatrics from Pittsburgh.
Okay.
Okay, University of Pittsburgh. Very nice, wonderful doctor.
All right. Um, does anyone
Any,
have?
any any other question? So I hope you learned a little bit because I was trying to go through all the slides.
Yes. Thank you so much, Dr. Kamal.
It was a little bit fast, but I hope you learned something.
I think we all can take something home from this lecture.
Okay. Okay, then thank you. I'll let you go.
All right.
Okay.
Thank you so much, Dr. Kamal.
Okay. Assalamu alaikum.
Walaikum assalam.